I loved to dance. I was to the point where I didn't even, I didn't know if I could dance or not, but I really wanted to dance at the wedding, and I did. But I can't tell you the pain afterwards of doing that. So that was really affecting my lifestyle as far as dancing. It was even affecting my swimming. I loved to swim, and it got to the point where I couldn't do the breaststroke, which I love, and also, let's say, freestyle, because I couldn't do the kicks that I wanted to do. So it affected me in many ways. I've always been an athlete of the past and still very active, just trying to stay in, I'd say, at least decent physical shape. All the things I loved doing, I was getting to the point where I couldn't do them anymore. I visualized it like kind of like a duck. I was waddling all the time, and it was very embarrassing to me.
Kind of a hollowish gray.
I'm Stephen Lewis, orthopedic surgeon, and I have been in private practice now for 15 years.
I'm different than most doctors in that I try and use humor and wit and make a serious situation lighter to put someone at comfort,
Right.
at ease.
Right.
And I think it helps build the trust.
Right. It does, believe me.
My professional field has always been as an educator and also in athletics. I had the opportunity to coach several sports at my last employment at Oak Park River Forest High School. Well, I thought I was facing a lower back problem that I previously injured 2 years before I was referred to Hinsdale Orthopedics. And I made an appointment through a friend of mine with Dr. Zindrick. And he immediately, within 5 minutes, said, "Your problem is not your back, but your problem actually is your hip." After walking down the hallway, he referred me to Dr. Lewis, and it's the best thing that ever happened to me, believe me. I did my research, and I was very impressed with what I was reading, and I liked the idea of this new technique of direct anterior surgery for a total hip replacement.
The direct anterior approach advantages are multiple. Generally, the patients seem to have much less pain. Their mobility returns much more quickly. The restrictions of not putting your leg in certain positions is non-existent with the direct anterior approach. The x-ray guidance in the operating room enables me to know that by the time the person's leaving the operating room, their leg has the same length and width as the other leg, which balances the patient, which will help in their rehab, which will help with lower back pain, which would help with knee pain.
And I realized I was very fortunate after doing research that there's a special table that they use in performing the operation, which was a big advantage to any doctor that's trained, which is very few at this point that I know of in Illinois for the anterior approach. The advantages that they had with the table, the alignment of the leg, the range of motion, the x-ray that they could take when they were doing the surgery. As far as Dr. Lewis, I liked him from the minute I met him, and I love his bedside manner. He's got a little humor to him, and I like that too. But I heard wonderful things about him because I'm very particular when I have surgery. And I've had several, but most of them are related to athletic injuries in the past. I have to say that after the surgery that I was totally shocked how quickly that I rebounded. It just gave me an entirely different outlook on life. I highly recommend Dr. Lewis. I mean, it's unbelievable. Dr. Lewis's team is fantastic. But to mention an outstanding PA that he has, which is Katie O'Connell. She met with me before Dr. Lewis made his appearance in the office. She really relaxed me and answered many of my questions about the procedure that I was committing to. And I realized that she assists him sometimes not in surgery. This is top notch. Everyone here is top notch. And I was amazed that I really did get out of bed that afternoon. Dr. Lewis, I saw him in 2 weeks after the surgery, And I said, what do I do? Because I never used crutches. I had a cane from the walker. And I said to him, what do I do with this cane? And I love this. This is his humor. But he was serious. He said, lose it. And that's what I did. I lost the cane. I've got a full recovery. It's just amazing, really. I have full range of motion. The recovery rate is just unbelievable. Like I said, right now, I can do anything. I even played golf at the end of the season. I didn't think that would happen this year, but I played some golf, and next year I'm going to really get back into my golf. I felt that every doctor that I chose at that particular time was the best. And I like your bedside manner from the first time I met you. And you're down to earth, but I also realize how talented you are and how famous that you're developing a rep for this anterior replacement, total hip replacement. And so I was at ease with you immediately after I probably met you for about 5 minutes, because you got a humor about you that relaxed me a little bit.